If you are on Medicare right now, I need you to check your next Social Security deposit very carefully because one number changed in 2026, and for many seniors, it is quietly taking a bigger bite out of their monthly income than they expected. That number is the standard Medicare Part B premium. In 2025, most people paid $185 a month. In 2026, that standard amount rose to $202.90. That is an increase of $17.90, almost 10%. And because Part B is often deducted directly from Social Security, many people do not notice the increase until the deposit hits their bank account and the check looks smaller. Today, I am going to walk through what changed, who pays exactly $202.90, who may pay more, who may pay less, and what to do if this deduction is hitting your budget harder than you can handle. Stay to the end because the last two checks are the ones that can potentially reduce what comes out of your Social Security every month. And real quick, if you are not subscribed yet, this is exactly the kind of thing I track on this channel. Medicare rules change. Social Security rules change. Premiums, deductibles, income limits, and benefit rules change all the time. The people who watch these changes early usually have options. The people who notice after the money is already gone usually have a much harder time fixing the problem. Let us start with the basic change itself. In 2026, the standard Medicare Part B premium is $202.90 per month. Part B is the part of Medicare that generally covers doctor visits, outpatient care, preventive services, durable medical equipment, and many medically necessary services that are not part of hospital coverage under Part A. If you are enrolled in Part B and you have your premium deducted from Social Security, then this premium is often invisible until you compare the gross benefit with the actual deposit that lands in your bank account. That is the first check I want you to make. Check number one, compare your gross Social Security benefit with your net deposit. A lot of people only look at the bank deposit. They do not look at the award notice, their annual Social Security update, or the Medicare deduction listed on the statement. If you only look at the net amount, you can miss what is happening. Log into your My Social Security account, review your benefit details, and look at the amount before deductions. Then compare that amount with what arrived in your bank account. If the difference is $202.90, that is likely the standard Part B premium. If it is more than that, keep listening because there may be something else going on. Check number two. Confirm whether you are paying only the standard Part B premium or whether you are being charged an income-related adjustment amount, commonly called IRMA. IRMA is one of the biggest reasons a Medicare premium can jump far above the standard amount. Medicare uses income information from your tax return from 2 years earlier to decide whether you owe a higher premium. That means your 2026 Medicare premium can be affected by your 2024 income. If you had a big income event in 2024, such as selling property, taking a large IRA distribution, converting money to a Roth IRA, or having a one-time spike in income before retirement, Medicare may be treating you as a higher income beneficiary even if your income is much lower now. This catches people off guard all the time. They retire, their paychecks stop, and they assume their Medicare premium will reflect their current situation. But Medicare is looking backward. So if your premium is far above $202.90, do not assume it is permanent and do not assume it is correct for your current life. That leads to check number three. If your income has fallen because of a life-changing event, ask whether Form SSA 44 can reduce your premium. Form SSA 44 exists for situations exactly like retirement, marriage, divorce, death of a spouse, loss of income-producing property, loss of pension income, or a major reduction in work. If your current income is much lower than the income Medicare used, you may be able to request a new determination that can lower or even eliminate the IRMA surcharge. This is especially important for retirees who had one high-income year and are now living on far less money. If you sold a house, did a Roth conversion, or had a final high-income work year, you should look into this immediately. And let me be clear here, many people think a higher Medicare premium is simply part of retirement and there is nothing they can do. That is not always true. If the premium increase comes from an outdated picture of your income, you may have a right to challenge it. Now let us talk about the people whose premium may be too high for a different reason. Check number 4. Find out whether your state can pay your Part B premium through a Medicare savings program. This is one of the most overlooked forms of help for seniors on limited incomes. Medicare savings programs are state-run assistance programs that can help pay Medicare costs. The best-known version is the Qualified Medicare Beneficiary Program, or QMB. If you qualify, the state may pay your Part B premium and can also help with other Medicare cost sharing. There are also SLMB and QI programs that can at least help cover the Part B premium. Why does this matter so much right now? Because a premium of $202.90 may not sound life-changing to some people, but to someone living on a modest Social Security check, it can be the difference between covering groceries and not covering groceries. It can be the difference between keeping up with utility bills and falling behind. And here is the part many seniors never hear. Medicare does not automatically enroll you in these programs just because your income is low. You generally have to apply through your state Medicaid office or the appropriate state agency. If your income and assets are limited, you should not assume you have to keep paying this premium without checking first. Check number 5. Do not stop at Part B. Look at your prescription drug costs and your Part D plan at the same time. Why? Because many seniors focus on the Part B deduction, but the real monthly strain often comes from everything else happening around Medicare at the same time. In 2026, the out-of-pocket cap for Medicare Part D prescription drugs is a major protection, but you still need to make sure your plan covers your medications in the most cost-effective way. The premium increase hurts even more when you are also paying too much for prescriptions, using the wrong pharmacy, or missing extra help eligibility. If you receive low-income subsidies or qualify for extra help, your prescription costs may be much lower than you think. If you do not know whether you qualify, ask. If you are already approved for certain Medicare savings programs, you may automatically qualify for extra help as well. That combination can reduce both the pressure from the Part B premium and the pressure from prescription drug spending. Check number 6. Know that not everyone will feel the increase in exactly the same way because the hold harmless rule protects some people. This is important. Some beneficiaries are protected by what is often called the hold harmless rule. In general terms, for many people who have their Part B premium deducted from Social Security, the law prevents the dollar increase in their Part B premium from reducing their net Social Security benefit from one year to the next if the Social Security cost of living adjustment is too small to cover it. In plain English, that means some people are shielded from a large jump in the deduction if it would otherwise wipe out their increase, but that protection does not apply to everyone in every situation. High-income beneficiaries paying IRMA may still face larger costs. People who are not having their premiums deducted from Social Security can be affected differently, and people new to Medicare may not have the same protection either. So if you hear someone else say their deduction did not rise the same way yours did, that does not automatically mean there is a mistake. It may simply mean different rules apply. Now let us step back and talk about what this premium increase means in practical terms. A lot of retirees get lulled into thinking a change of $17.90 is small because they see bigger numbers in the news all the time. But for someone living mainly on Social Security, what matters is not the headline number. What matters is how many recurring bills are rising at the same time. Medicare goes up, utilities go up, food goes up, insurance goes up, property taxes go up. And when several mandatory expenses rise together, your room to maneuver shrinks. That is why you should not treat this as just another routine annual adjustment. Use it as a trigger to review your whole Medicare setup. Ask yourself these questions. Am I paying only the standard Part B amount, or am I being charged IRMA? Has my income changed enough that I should file Form SSA 44? Could I qualify for a Medicare savings program? Could I qualify for extra help with prescription costs? Am I using the best Medicare drug plan for my current medications? And am I actually reading the notices Medicare and Social Security send me, or am I only looking at the bank deposit? Those questions matter because the biggest Medicare mistakes are often not dramatic. They are quiet: a wrong premium tier, a missed application, an outdated income record, a drug plan that no longer fits, a benefit you qualify for but never claim. Let me also add this. If your deposit suddenly looks much smaller and you cannot immediately tell why, do not panic and do not assume the government made a random mistake. First, identify whether the change came from Medicare, from tax withholding, from garnishment, from a change in your own benefits, or from another deduction. When people panic, scammers often take advantage of that. If someone calls you claiming they can fix your Medicare premium if you pay a fee, hang up. If someone asks for a gift card, a bank password, or a one-time security code, it is a scam. Use official channels. Review your Medicare notice. Review your Social Security statement. Contact Medicare or Social Security directly if you need help understanding the deduction. So let us bring this together. The standard Medicare Part B premium in 2026 is $202.90 per month, up from $185 in 2025. Because the premium is often deducted from Social Security, many seniors will first notice it when their bank deposit looks smaller. Your first step is to compare your gross benefit with your net deposit. Your second step is to determine whether you are paying only the standard premium or an IRMA surcharge. Your third step is to consider Form SSA 44 if your income dropped after a life-changing event. Your fourth step is to check whether a Medicare savings program could pay your premium. Your fifth step is to review prescription assistance, including extra help and your Part D plan. And your sixth step is to understand that protections like the hold harmless rule can make people's experiences different. If you do those 6 checks, you will understand far more about your Medicare costs than most people do. And that matters because when a recurring deduction comes out of your Social Security every month, even small misunderstandings turn into big annual losses. If this video helped you, subscribe and share it with a parent, a spouse, a friend, or a neighbor who is on Medicare. One conversation about a premium, a subsidy, or an appeal form can save real money over the course of a year. I will see you in the next video.